The oral cavity harbors a large number of microorganisms, which include bacteria, fungi, parasites, and viruses. This poses a risk of transmission of infection through aerosol and splatter that are normally generated during dental treatment. Aerosol generated spreads in the surrounding and that can reach as far as 3 feet of distance from the patient. The handpieces used in dental treatment can act as a source of infection not only to the patient but it can also infect the operating surgeon. The biofilms formed in the dental unit waterlines could be spread by aerosol created by a dental handpiece, and it presents a risk to both patient and the operating surgeon. The dental chair consists of water reservoir bottles to supply water to the dental unit waterlines. Now, these bottles are filled with the water and they easily get contaminated with the bacteria which is present on the skin of the people, such as Staph epidermidis and Staph aureus. Dental unit water lines must be cleaned periodically. The clean and dry handpiece harbor few bacteria, but contamination of the handpiece lumen with salivary bacteria occur during its use. If you wipe the outside of the handpiece with disinfectant, it does not eliminate the risk of potential cross-infection because the lumen continues to harbor the pathogenic bacteria. So, water samples from the dental units is often found to be heavily infected with bacteria, and some of them are of oral origin that comes from the oral cavity of the patients, which colonize the water pipes of the unit. There is a distinction between the term sterilization and disinfection. When we say sterilization, we are referring to the condition which in which the destruction of all microbial forms take place, which include viruses, but more importantly, the spores of the bacteria. The disinfection refers to the destruction of pathological microorganisms only. It is often term applied to the procedures that are incapable of destroying the spores. So when we say that we have disinfected an instrument, we mean that we have destroyed all the pathogenic microorganisms, but the spores may have left behind. In today's dental practice, the risk of transmission of viral infections like hepatitis B and hepatitis C is quite common. And so the emphasis is on the process of disinfection more than sterilization. It is universally accepted as an effective way for disinfection and sterilization of surgical instruments. Glutaraldehyde is a chemical that is used as a cold sterilant to disinfect and sterilize heat-sensitive medical, surgical, and dental equipment. It provides high level of disinfection in 10 minutes. The time required for proper sterilization is around 10 hours. So you have to leave the instrument in the glutaraldehyde solution for overnight. An important disadvantage of using glutaraldehyde to disinfect the dental pieces and dental equipment is its reduced efficacy in presence of organic matter and greasy residue. It is important to note that the instruments and the dental handpieces should be pre-cleaned with multi-enzyme cleaning solution before they are taken for disinfection using glutaraldehyde. The details of the procedure of pre-cleaning of surgical instruments are given in a separate video. You can check the link of the video in the description. Most of the adverse effect of the glutaraldehyde is noticed in relation to respiratory system or skin. Most of the adverse effects are due to inhalation of glutaraldehyde fumes while using the glutaraldehyde for disinfection purpose, or The the glutaraldehyde solution coming in contact with the skin and causing allergic reactions. Most of the side effects or the adverse effect of glutaraldehyde are breathlessness, rhinitis, eye irritation, and dermatitis. You can find a link to a video giving the details about the health hazards of glutaraldehyde use. Mask must be used while providing any treatment to patient in a dental setup. The reason is the presence of aerosols, which have pathological microorganisms which are responsible for transmission of infection from the patient to doctor or vice versa. The oral fluid becomes aerosolized during dental treatment, and oral microbes have been used as a marker of the spread that they carry bloodborne pathogens. Aerosols are defined as small droplets, usually 5 micron or less in diameter, which can remain suspended in air for some time. So, the bacterial aerosol are an important consideration for infection control and occupational health in dental clinic, since infective agents can be transmitted via aerosol to the patient or dental staff. So, masks and other personal protection measures must be taken while offering any treatment to any patient in any dental setup. Check the dental handpieces before any procedure is attempted on the patient. Since the dental handpiece consists of lumen and fissures, they retain the infective material from the patient, and this make it very inconvenient to clean and disinfect. The spores existing inside the lumen may survive autoclaving unless it is treated on its interior surface with chemical disinfectants. Since these microorganisms are anchored to this equipment, they may not be readily detached on flushing, but may shed pathogens on high-speed operations. The lumen poses to be an additional potential site of internal contamination, which may lead to its high risk of cross-contamination unless it is sterilized in between the patients. So, the lumens and fissures of all dental handpieces must be adequately disinfected with glutaraldehyde solution before any fresh patient is taken. Glutaraldehyde are useful in disinfection of the biofilms which are present in the dental unit waterlines. To avoid bacterial contamination in dental unit waterlines, protective walls can be installed to prevent the backflip of water from the handpiece into the waterlines. Studies suggested there is high risk of transmission of HIV from dental personnel to the patient and from the patient to patient. Studies reveal that bacterial biofilm were found on the inner walls of the plastic tubing supplying water to constituents of dental unit using a scanning electron microscopy. These biofilms could be found in any tubing that supplies water to the dental unit. The source of these biofilms comes from the environmental aquatic bacteria which can cause infection in vulnerable patients. So the commonly found the bacteria in these handpieces includes Legionella lactobacillus, Actinobacillus, Micrococcus, Staphylococcus, Pseudomonas, Klebsiella, Streptococcus, Staph aureus. So the glutaraldehyde is advisable for disinfection of biofilms in these water lines.
Hope you liked the video. Feel free to share your views on this issue in the comment section. Check the description for similar videos and product links.